Hey Alpha Nurses, I'm Nurse Sandra from alphanursguide.com. This is NCLEX PN Review Lesson 42, Pediatric Nursing Questions. You can get my notes on Etsy. Be sure to follow my store to get any updates of new notes. You can follow me on Facebook, Instagram, and TikTok for more content. All links are in the description. Without the way, let's get started.
Question 1. A child is scheduled for a tonsillectomy. Which should present the highest risk of aspiration during surgery? A. Difficulty swallowing. B. Bleeding during surgery. C. Exudate in the throat area. D. The presence of loose teeth. The correct answer is D. The presence of loose teeth. Rationale: in the preoperative period, the child should be observed for the presence of loose teeth to decrease the risk of aspiration during surgery. Bleeding during surgery will be controlled via packing and suction as needed. Question 2. The nurse is reinforcing instructions to the mother of an 8-year-old child who had a tonsillectomy. The mother tells the nurse that the child loves tacos and asks when the child can safely eat one. The nurse should make which response to the mother? A. In 1 week. B. In 3 weeks. C. 2 days following surgery. D. When the healthcare provider says it's okay. The correct answer is B. In 3 weeks. Rationale: rough, scratchy foods or spicy foods are to be avoided for 3 weeks. Citrus juices, which irritate the throat, need to be avoided for 10 days. Red liquids are avoided because they will give the appearance of blood if the child vomits. A full liquid diet is allowed on the second postoperative day, and soft foods are allowed as the child tolerates them. Question 3. The nurse is reviewing the laboratory results of a child scheduled for tonsillectomy. Which laboratory value would be significant to review? A. Creatinine. B. Urinalysis. C. Platelet count. D. Blood urea nitrogen. The correct answer is C. Platelet count. Rationale: before the surgical procedure, the child is assessed for signs of active infection and for redness and exudate of the throat. Because the tonsillar area is so vascular, postoperative bleeding is a concern. The platelet count result would identify a potential for bleeding. The blood urea nitrogen and creatinine would not determine the potential for bleeding, but rather evaluate renal function. Question 4. The nurse is monitoring a child following a tonsillectomy. Which finding would indicate that the child is bleeding? A. Restlessness. B. A decreased pulse rate. C. Complaints of discomfort. D. An elevation in blood pressure. The correct answer is A. Restlessness. Rationale: frequent swallowing, restlessness, a fast and thready pulse, and vomiting bright red blood are signs of bleeding. An elevated blood pressure is not an indication of bleeding. Complaint of discomfort is an expected finding following a tonsillectomy. Question 5. The nurse is caring for a 2-year-old child diagnosed with croup. The nurse collects data on the child, knowing that which is characteristic of this illness. Select all that apply. A. The cough is harsh and metallic. B. Inspiratory stridor may be present. C. Symptoms usually worsen at night and are better during the day. D. Symptoms usually worsen during the day and are relieved during sleep. E. It is usually preceded by several days of upper respiratory infection symptoms. The correct answers are A. The cough is harsh and metallic. B. Inspiratory stridor may be present. C. Symptoms usually worsen at night and are better during the day. And E. It is usually preceded by several days of upper respiratory infection symptoms. Rationale: croup often begins at night and may be preceded by several days of upper respiratory infection symptoms. It is characterized by a sudden onset of a harsh, metallic cough, sore throat, and inspiratory stridor. Symptoms usually worsen at night and are better in the day. Question 6. A child with croup is being discharged from the hospital. The nurse reinforces home care instructions to the mother and advises the mother to bring the child to the emergency department if the child develops which symptom? A. Stridor. B. Irritability. C. Tiredness. D. Poor fluid intake. The correct answer is A. Stridor. Rationale: the mother should be instructed to bring the child to the emergency department if the child develops stridor at rest, cyanosis, severe agitation, or fatigue, moderate to severe retractions, or is unable to take oral fluids. Question 7. A hospitalized 2-year-old child with croup is receiving corticosteroid therapy. The mother asks the nurse why the healthcare provider did not prescribe antibiotics. The nurse makes which response to the mother? A. The child may be allergic to antibiotics. B. The child is too young to receive antibiotics. C. Antibiotics are not indicated unless a bacterial infection is present. D. The child still has the maternal antibodies from birth and does not need antibiotics. The correct answer is C. Antibiotics are not indicated unless a bacterial infection is present. Rationale: antibiotics are not indicated in the treatment of croup unless a bacterial infection is present. For answer choice A, the question does not include any supporting data to indicate that the child may be allergic to antibiotics. Question 8. A mother arrives at the emergency department with her child, and a diagnosis of epiglottitis is documented. Which of the healthcare provider's prescription should the nurse question? A. Obtain a throat culture. B. Obtain axillary temperatures. C. Administer humidified oxygen. D. Administer antipyretics for fever. The correct answer is A. Obtain a throat culture. Rationale: the throat of a child with suspected epiglottitis should not be examined or cultured because any stimulation with a tongue depressor or culture swab could cause laryngospasm and complete airway obstruction. Humidified oxygen and antipyretics are components of the treatment. Axillary, rather than oral temperatures should be taken. Question 9. The emergency department nurse is gathering initial data on a child suspected of epiglottitis. Which is the nurse's highest priority? A. Check for a patent airway. B. Prepare the child for an X-ray. C. Prepare the child for tracheotomy. D. Assist the healthcare provider with intubation. The correct answer is A. Check for a patent airway. Rationale: when epiglottitis is suspected, the priorities are to maintain a patent airway and to next obtain an X-ray to confirm the diagnosis. If epiglottitis is present, the child is taken promptly to the operating room for tracheal intubation. Although options B, C, and D may be components of care, they are not the priority. Question 10. The nurse caring for an infant with bronchiolitis is monitoring for signs of dehydration. The nurse monitors which method as reliable for determining fluid loss? A. Intake. B. Output. C. Skin turgor. D. Body weight. The correct answer is D. Body weight. Rationale: body weight is the most reliable method of measurement of body fluid loss or gain. 1 kilogram of weight change represents 1 liter of fluid loss or gain. Although options A, B, and C may be used to determine fluid status, they are not the most reliable determinants.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.